Where do food poisoning pathogens in children come from? Imagine your child enjoying a meal, but hidden inside could be tiny germs that cause food poisoning. These germs come from places where food and water might be contaminated. They are bacteria, viruses, or parasites that can grow or be transferred through food, water, or surfaces. Most often, these germs originate in raw or undercooked foods like meat, poultry, seafood, and eggs. Bacteria such as Salmonella, Campylobacter, and Escherichia coli are common culprits. If these foods are not cooked thoroughly, the germs can survive and cause illness. Unpasteurized milk and soft cheeses are also risky because they may contain bacteria like Listeria. These products are not heated to kill germs, so they can be contaminated. Fruits and vegetables can carry germs if they are not washed properly. Soil, water, or handling during harvesting can introduce bacteria or parasites. Processed meats and deli foods can also be contaminated if not stored or cooked properly. For example, Listeria can grow in cold environments if food is not kept at the right temperature. Honey is another source to watch out for. It can contain spores of Clostridium botulinum, which can cause infant botulism. That is why babies under 1 year should not eat honey. Contaminated water is a common source of germs too. Drinking or using water that has bacteria or parasites can lead to foodborne illnesses. Cross-contamination is a big concern during food preparation. Germs from raw meat or eggs can transfer to ready-to-eat foods through cutting boards, utensils, or hands. This spreads the germs and increases the risk of illness. Environmental sources like soil, dust, and animal feces can also carry bacteria or spores that contaminate food or surfaces. Children are especially vulnerable because their immune systems are still developing. They can become dehydrated quickly from vomiting or diarrhea caused by food poisoning. Infants under 6 months are at higher risk from spores in honey or contaminated water. Preventing food poisoning involves good hygiene and safe food handling. Always wash fruits and vegetables thoroughly. Cook meats and eggs completely. Avoid giving honey to babies under 1 year. Use clean water for drinking and cooking. Store food at the right temperatures and prevent cross-contamination by using separate cutting boards and utensils for raw and cooked foods. In summary, food poisoning germs in children mainly come from contaminated foods like raw meats, unpasteurized dairy, and improperly handled produce. Water sources and environmental contamination also play a role. The germs involved include bacteria like Salmonella, Campylobacter, E. coli, Listeria, Bacillus cereus, and Clostridium botulinum, along with viruses and parasites. Following proper food safety practices helps protect children from these illnesses. Always consult healthcare professionals if your child shows signs of food poisoning or illness.